At a vaccination center in the Kenyan capital, Nairobi, Kenya's mass vaccination exercise against COVID-19 continues. Kenya, like the rest of Africa, is accelerating its vaccination program as the Delta variant drives another wave of infections. The initial vaccine hesitancy may not be completely waned, but by and by, the government is finding it does not have to convince citizens to roll up their sleeves.
Well, of course, fear is always there. I myself was afraid because I honestly don't know about the side effects. However, contracting the virus and being ill is worse than dealing with the side effects.
They should take it if they care about their families and their own selves.
Why do you say that? Have you seen anybody who is sick? Have you heard? Do you know anybody?
I know. I have heard of my friends who have passed on.
Who have passed on?
And some people who are friends who have been sick.
It's important so that we can go back to our businesses.
Kenya has depended on donations of COVID-19 vaccine doses to sustain its mass vaccination program. This particular center vaccinates more than 500 people every day, the demand clearly outweighing the supply. And it is not just supply constraints. Logistical barriers of getting the vaccines to those who need them have hampered faster rollout.
I came for vaccine today, but having come here, the people offering the vaccine are telling me to go away, that the vaccine they have will not be enough for the people who are already on that line.
At the Ministry of Labour offices in Nairobi, employees queue to get their first dose of the COVID-19 vaccine. This following a directive by the government that all public servants must have gotten their first dose by the 23rd of August. Kenya has vaccinated less than 2% of its adult population. As supply increases following donations from bilateral partners and in a few weeks from the African Union's African Vaccine Acquisition Trust, AVAT, Kenya is hoping to fully reopen its economy and mandatory vaccination of public servants as a matter of priority, according to the government circular, means they can resume duty in their offices and offer uninterrupted services to the public. But can a government impose a vaccine mandate?
Often public health trumps individual rights, but under certain circumstances. One, the intervention you're promoting must be widely available and accessible, meaning that if you're talking about mandating the vaccine, this vaccine should be widely available and accessible to people. And two, there is the argument around emergency licensure of this vaccine. This vaccine is not yet fully licensed. With employers eager to return to pre-pandemic days, it is clear that private companies will soon follow suit. The proportion of people who have been vaccinated are increasing, meaning that if I'm vaccinated, I have also a right to be protected from what I would call probably irrational behavior for refusing to be vaccinated when there is evidence that the vaccine is safe and it's available at no cost to you at the point of use. Two, the corporations are going to play a big part in this. A lot of people are employed by private corporations, whether it's a small restaurant or whether it's a telecommunication company. They may decide that, it's your right not to be vaccinated, but do not step in the premises before you're vaccinated. And it may get to the point where, like, okay, we need to go back to physical presence in the offices. So that will push people to. So in a way, it might be a combination of a bit of stick and carrot. So there are benefits if you get vaccinated, your individual protection, but also you can access services, you can go to public places, and if you're not vaccinated, well, they may pretend as if there are no sanctions, but then what you denied might really push you to get vaccinated. If the queues witnessed in Nairobi across various vaccination centers are anything to go by, then the certain nudge by the government may well have worked in increasing uptake. Sarah Kimani, SABC News, Kenya.